Hello, and welcome to the Freshwell Diabetes Programme in association with the Freshwell Low Carb Project. My name is Dr. Kim Andrews, and I am a GP in Finchingfield in Essex, and also a GP with a special interest in diabetes. Today, I'm going to talk you through an introduction to diabetes, and this might be useful if you've recently been diagnosed and want to understand more, or if you may have had it for some time but want to know more about what you can do to help yourself to improve your diabetes control. Just as a quick disclaimer, this presentation should be classed as information only and not personal medical advice, and you should always check with your doctor or nurse before starting any new lifestyle changes, particularly if you suffer from any long-term health conditions, eating disorders, if you're pregnant, breastfeeding, or under the age of 18. And this is particularly true if you take any long-term medications, especially for type 2 diabetes or blood pressure, as you may well need to reduce your medication. So let's take a look at diabetes. There are currently over 3.2 million people diagnosed with diabetes in the UK. And in fact, recent numbers have shown that 1 in 10 people over the age of 40 have a diagnosis. Around 90% of those people diagnosed with diabetes have type 2 diabetes. And this is more common, again, in people of African, Afro-Caribbean and South Asian origin. Type 2 diabetes can be caused by various factors, ones that we control and ones that we can't. So certainly diet plays a part, our weight plays a part, inactivity, genetics and medication that we take can also sometimes lead to type 2 diabetes. There are ways of maintaining good control and helping your control of diabetes to be good, and methods include, being well educated on it, knowing what will affect your blood sugar, knowing what in your lifestyle will make your sugar higher or lower, and also maintaining very good blood pressure control and good control of your blood sugar. So what is diabetes? Essentially, diabetes is a disease which is caused by either a lack of or reduced effectiveness of a hormone produced by our body called insulin. And it's essentially characterized by raised blood sugar. There are generally 2 main types that most people think of. These are type 1 diabetes, where there is an absolute deficiency of insulin. People do not produce insulin and they need to be given that. The other type, the more common type, is type 2 diabetes, and this is essentially caused by people becoming very resistant to their own amounts of insulin, so they need higher and higher levels of insulin to get the effect that they need. And you can think about it as being a lock and key event, where basically you want the blood glucose to go into the body cells, and there are little locks on these cells, and insulin is the key that will open those locks and allow the glucose to be taken up into the cell. And obviously, if the glucose isn't being taken up into the cell, then the levels in the blood are going up and up and up. And symptoms of high blood glucose include being very thirsty, peeing a lot, losing weight because the body can't actually utilize that blood sugar even though it's there. People feel very tired, and they can also get recurrent infections, particularly sort of thrush in the mouth or in the genital area. And what are the complications of diabetes? Well, very broadly, they can be put into 2 categories. That is macrovascular, and this is the effect of the blood glucose on the large blood vessels, and these can cause problems such as heart disease, vascular disease peripherally, where we get clogging up in our arteries of our legs, and also stroke, which is a problem with the blood vessels in the brain. Then the second classification is generally microvascular complications, and this is caused by damage to the small blood vessels in the body, and these complications tend to occur at the back of the eye in the retina, retinopathy within our kidneys, which is called nephropathy, and also neuropathy, which is an effect of the blood glucose on our nerves. And all of these complications can be prevented or minimized with good blood pressure and sugar control.